Hi, I'm Rob Locke.
And I'm Sandra Staggs. Thanks for joining us for this very important program. Important because if you are a man or if you love a man, this show can make a difference in your life.
Now, you've no doubt been hearing about Pos-T-Vac for years now. And you may know that it is the all-natural alternative to prescription drugs for men with erectile dysfunction, or ED. But did you know that doctors and millions of couples all over the world have discovered that Pos-T-Vac can enhance or even restore your own natural sexual ability? And here to help us understand more about ED and what we can do to correct it is Dr. Ken Rutledge. Dr. Rutledge is a board-certified urologist and surgeon specializing in the treatment of erectile dysfunction and its related causes.
Now, he's been practicing for more than 30 years in the U.S. and abroad and is currently a specialist with Urology Associates, a prominent medical group. Dr. Rutledge, thank you so much for joining Rob and I today. Welcome to the show.
Well, thank you. It's good to be here with you today.
Thank you.
Thank you. Great to meet you. What are some of the reasons or the underlying causes that these men have when they come to your office?
Men with ED, there's just about every organic cause you can imagine can be involved with this. Any of the organic diseases that can cause problem with blood flow, any of the nerve damage like surgery, and anything that can lower the testosterone levels. All of these can be associated with ED.
So it's not just all in your head.
Absolutely. And organic diseases are the cause of 90% of the ED issues. The number one reason for ED is smoking, but we also see anything that affects the vascular supply, and diabetes being one of the biggest ones. High blood pressure, high lipid levels, and obesity. This is rampant. 48 million Americans.
You have these problems and you're taking medications, probably your medication's affected as well.
Exactly. So it's an awful situation because not only the disease state can affect it, but also the medicines that you may be taking. We're using high blood pressure medicines and using them to lower the blood pressure to keep a person from having a stroke or a heart attack. But anything that we use to lower the blood pressure may also be a part of causing ED.
It's a kind of a catch-22, isn't it? Because if you have high blood pressure or you're taking medication for it, or you have heart disease and you're taking medication for it, and that produces ED, then you're totally darned whether you do or you don't.
And it's great that we have alternatives today. And that's where the next step in my algorithm would be to go to Pos-T-Vac, or the vacuum erection device, for treatment. And so what we see today is between 40 and 70 years of age, over 50% of men will have some degree of ED.
Wow.
So this is a very, very common problem.
Now, the obvious treatment that I think probably everyone on the planet knows about are those three little types of pill that you can take, the Viagras and Cialises and Levitras of the world.
Yeah, I call that the chocolate, vanilla, and strawberry.
Great with ice cream.
People want quick fix. I mean, people, they want to pop a pill for everything. And I would prefer to do something that is a little bit more natural.
And these pills are good when they work, but recognizing that many causes of ED, the ED is too disease state. There's too much disease state for the medicines to work. When they don't work, then we move on to use a vacuum erection device. That's my next go-to.
And what is a vacuum therapy system? What is?
Well, these are very simple mechanical devices, and the nice thing about it, once somebody purchases it, you've got it, so there's no extra cost involved with that. But this is a simple tube that goes over the penis to suction up an erection, and then a soft elastic ring that goes down to the base of the penis to maintain erection. Now, we don't want to maintain erection over about 30 minutes with this type of device, and when we do rehab, typically we'll do 10 minutes a day.
Then this is it's almost like a workout as well.
Exactly, because what we know is that when we use these, there will be greater natural return erections quicker.
Oh, so you can get back to your old performance level if you go through therapy.
And
that's interesting.
And also we know that it will keep a man from losing length, which is important, I think, to every man.
I would say that's probably quite important, yes.
How quickly does it work?
These work very quickly, as opposed to the medicines, which were dependent on absorption and vary from 30 minutes to an hour. This will begin being effective within 4 minutes. So
that sounds very, very good
That's
to me.
fast.
Yeah.
That's
Because
very fast.
It's something that we see is a very simple solution, but a very good long-term solution.
Yeah. So how effective is it?
It can be as highly successful as 95%. So,
wow.
so these are highly effective devices that give a good degree of success.